Well, good afternoon, all. I've been working as a physiotherapist in primary healthcare for 43 years. I was trained as such, but also finished partly a study in psychology at university. And I have been working with a very diverse population of people, youngers, older ones, top sporters, recreational sporters, but most of all with people with complex, persistent complaints, as called in my title, usually called as unexplained complaints. But that isn't the right word, but in the mainstream, they call it as such. I'm still amazed about the lack of appropriate care for these people with these complaints. One of the causes is that healthcare system is a dual-oriented system divided into physical and mental care. And although most of the complaints are at the border between the physical and the mental domain, and there are persons of 60 to 70% of patients who are going to a hospital or a specialist have these complaints. But what we see is, although most of those complaints are complex, the actual performance of the professional workers is that they are stick to and focused on symptoms and not more. They work from their own domain, their own box. And there's a nice analogy we can make from this point, from out the systems theory, that when one is looking through a keyhole into an dark attic room, one only sees a small piece of the attic illuminated, but one cannot see the whole attic. And that's precisely how these complaints are treated. Most of the people with complex, extreme complex persistent complaints like fibromyalgia, chronic fatigue syndrome, neurological disorders, and these days, especially the people with long COVID, are sent from one specialist to another and very often without a cure or result. Precisely on the border between the physical and the mental domain, one could do much more for these people. And there are important lessons to be learned from new scientific evidence and insights and our own experience with people with these complaints. That's why my title is What Long COVID Can Teach Us That Science and Healthcare Are Overlooking. In my 43 years of practice, I've counted it several weeks ago. I think I had almost 200,000 patient contacts over all these years. And it was important for me to ask myself questions as what's going on here. How could these complaints arise, and what scientific evidence is there for my interventions? It was complex to find patterns behind the phenomena and the symptoms I saw, but this was also challenging, and it was also the beauty of my profession. The practical experience piled up, the referrals increased through the years, and there were so many dramatic examples of complaints. For instance, people with functional neurological disorders who were totally paralyzed, who were unconscious for several days, and who had pseudo-epileptic seizures. And these days, the long COVID patient group, great group, a big group, with totally disabled complaints and who couldn't do their work for a long time. but mainstream healthcare still has no solutions. As I said, it took for a lot of people, they must make a long walk through the medical system with high cost and very low results. These days, the post-COVID expertise centers are initiated, but they have to build up their expertise. They are focused and they can do more on solitary symptoms and instead of dealing with the full problem. I think that all these serious complaints should be approached in a totally different way. Therefore, we developed an integrated movement and behavior program years ago with and from out the observation that people with these complaints were physiologically totally disturbed. They had no normal regulation of their adaptation system, and an adaptation system is a system that through physiological processes, body, mind, and our behavior is adapting to everyday challenges, which enables us to survive. Those days, we find scientific consensus about several processes who were taking place with these patients. There was a reduced physical and mental resilience with fatigue and post-exertion reactions, disruptions of the central regulation system, neurohormonal systems were not working well, and also the nervous system, where a hypersensitivity was taking place. There were psychological complaints like anxiety, mood disorders, but also concentration and memory problems. And our own observation was there was a lack of energy through physiological disturbances. Neuroscientists revealed the mechanisms behind these signs during the last 30, 40 years, but that wasn't coming over to the mainstream. Those neuroscientists, as Bruce McEwen, Robert Sapolsky, Peter Sterling, Barbara Gensel, they revealed the mechanisms behind the disturbances which we see here. And they brought it together in the allostasis theory as a nuance of the homeostasis theory. They are telling us from the scientific insights that we are adapting to everyday challenges and stimuli much more dynamic and much more variable than we ever have assumed it would be. Every second, there's a fine-tuning taking place, and this is an abstract that I made from the allostasis model. And what I want to state is, in the mainstream healthcare, one is focused on the symptoms and the organs. It's organ-oriented. But when you want to treat the symptoms much more, you must go a level up or down, as you can name it, and you must look to the central regulation systems which are standing in the figure above. There takes the fine-tuning, the direction and the coordination of the peripheral adaptation place. This model matches closely the dynamics of health and science, and is also useful for the treatment of the chronic persistent complaints. Normal adaptation takes place where it's not by coincidence, but the central emotional systems of the brain are the director and the coordination. It's the reptile brain, evolutionary, the oldest part of the brain, and that together with the hormonal system, the immune system, and the neural system, they direct the organs, and there is every split second a fine-tuning is taking place. They work closely together, and there are several biomarkers from this allostatic process pointed to from science. I can show you, I can give some examples. When you, for instance, you look to the function of the immune system, the immune response is not starting in the peripheral organs, but it comes in action after it's triggered from the central emotional system of the brain that gives signs to the hormonal system and the unconscious nervous system to shut on the immune response. And then when the recovery response is done, those systems together also take care for the shut off of the immune response. This cannot be taken place in the organs themselves. There must be coordination and direction from superficial systems. This process of constantly dynamic coordinated action is called allostasis. When, for example, our system is triggered by chronic stress and extra stimulated by, for example, you have to do a lot of overwork for a long time, or there are long-during conflicts, or even with viral infections, the normal adaptation systems from out these regulatory mechanisms can handle that very well. We can say chronic stress, we are used to handle it because the systems take care that, for example, extra cortisol is made so that we can handle the stressful situation. But when this process continues too long, then chronic stress will become toxic, and within the scientific insights, there has been shown that a lot of dysregulation and exhaustion reactions, they are occurring. So, for instance, like in chronic stress, there is a situation of hypercortisolism. The system can become exhausted, and then a situation of hypocortisolism occurs. This process is called allostatic overload, and you can see that much in people with complex persistent complaints, for instance by the cortisol awakenings response. That's a normal response we have by normal biorhythm, but with people who have these complaints, they wake up later and they start up slower in the morning because of that status of hypercortisolism. Another illustrative example is from bullying in childhood. You can see, and there's evidence, that the amygdala is the fear and the emotional center of the brain, will enlarge, and also that there will become more connections in the amygdala. That has a certain aim because our system learns and anticipates to unsafe situations. That's what allostatic principles are telling us, so that we can survive even in unsafe situations. And that will bring for the person who has had that bullying period in his life, that there will become a stronger and faster response in dangerous situations, so that it can survive in unsafe situations, to improve survival. But in mainstream research, there's still a big focus on symptoms, on molecular systems, on solitary organs, and from the organ-oriented medicine, the care, they are also dealing just a lot of times from out of the tip of the iceberg and not of an overview as the example of the system theory looking to the whole ethic. We developed a program. It's called the Self-Action Energy and Recovery Management Program, which is an integrated movement and behavioral program built on the principles of the integral system principles from the allostatic model. We take the underlying physical disturbances as a starting point to tackle the symptoms, and those systems are, as I said, a result of the disturbances. So we go several levels deeper. We use for that a saving model, because with the intake we ask people, what is your status of your resilience? And we do that with a normal question as, how much energy do you really have daily available? People must score from 0 to 100, and 100 is that every new day there is full recovery of the day before and the battery is full charged. I explain it in a quick way. We do more, we ask more, but we also ask them, did your resilience decrease over time? Is there an actual question of going beyond the limits, and do post-exertional reactions cure? And those post-exertional reactions are reactions on simply daily activity with a total system reaction of feeling ill, feeling fatigue, and have all other kinds of complaints. Our rehabilitation of long COVID is therefore tailored and built up very, very delicately. As you can see, there's a long range of very diverse symptoms, and when you look to every single symptom, then it's difficult to treat. But when you look to the whole schedule of and the whole spectrum of symptoms, then you can see that every organ is triggered and is dysregulated. Scientific consensus, I name here several, is that after the COVID infection, there's a remaining of a high concentration of antibodies, and those antibodies are meanwhile very sensitive to stimuli. There is a low energy level and rapid existing post-exertional reactions, blood clots in the bloodstream, and you have heard maybe of it. Brain fog is also one of the longest existing symptoms, with poor concentration, fast overstimulation, and deteriorated memory and concentration. As I said, the rehabilitation must be tailored. Full recovery after every action must take place. And we teach participants to save energy. The score of 0 to 100 about the daily level of energy. Most of the people who are coming to us, they score a score of 10 or 20, and the aim is to build up that E-score to a higher level. The key is to rehabilitate these patients and meanwhile activate them without provoking disturbances. And we teach and we tell people that they must imagine they are acting like a kettle on the stove with water. They must and can be active, but when the first bubbles are arising from the in the kettle, they must stop their actions. It must not bubbling more, even it mustn't boil or boil over. It's very important to teach them proper daily energy and stimuli management. We use therefore a course book with instructions, with explanations, but also with formals to track their daily scores and complaints. It consists further of tailored physical actions, attention training, breathing and relaxation techniques. And we use therefore HRV, Tai Chi, mindfulness and yoga and so on. But the main issue of the main aim is still saving energy and try to build up the E-score. What's important is that physical, mentally and emotionally overloading should be avoided at any time, because when that happens, the high concentration of antibodies and the really great or big sensitivity of those antigens is great. And when you are overstimulated, you activate those antibodies, and micro-inflammatory reactions in the whole body will occur and will cause many of these complaints or symptoms. Well, I could tell much more about this and the allostasis model, but I hope these new scientific evidence and insights, along with our practical experience and success stories, will lead to a shift to address these complaints in a totally different way. In a different way, which much more goes to an integral level system approach from out the insights and the evidence that's built up in the allostasis theory. Because it acknowledges how we as humans are physiologically shaped by evolution. And we must go back to those primary functions and elements to deal in a good way with those complex complaints and other complaints. Implementing this all will be challenging, but that's the nice thing of these TED Talks here. And well, I hope and I see it offers a framework for understanding and addressing these complex complaints. It's necessary that from a systems approach, multidisciplinary approach, and on an effective way, we can go that way so that we can help people who are now deprived with these serious and very disabling problems. And, well, that's all I want to say. Thank you for your attention.